The aorta ends where it bifurcates into the right and left common iliac arteries. The common iliac arteries lie just above the top of the psoas major muscles of the abdomen, along a line running towards the center of the inguinal ligament. The common iliac arteries also bifurcate, giving rise to both the internal iliac artery or hypergastric artery and the external iliac artery. The internal iliac arteries are the vessels which provides the blood supply to the gluteal region, the urinary bladder, and the uterus in the female body, as well as give rise to the umbilical arteries during fetal circulation. The external iliac arteries serve as the continuation of the common iliac arteries and continue along the medial border of the psoas muscle towards the lower extremities. When the external iliac artery passes under the inguinal ligament, its name changes and it becomes known as the femoral artery. The femoral artery gives rise to several branches as it descends through the region of the thigh before passing through the opening of the adductor magnus muscle, where it becomes the popliteal artery. Among its branches are the medial and lateral femoral circumflex arteries, which provide the blood supply to the hip joint as well as the muscles of the supermost portion of the thigh. The other branch of the femoral artery is the deep femoral or femoral fundus artery. It runs much deeper in parallel to the femoral artery, providing the blood supply to the bone and muscles of the thigh. The popliteal artery is the continuation of the femoral artery as it passes through the opening in the adductor magnus muscle, at which point it lies behind the knee in the popliteal space and gives off branches providing the blood supply to the knee joint. The branches of the popliteal artery are the genicular arteries. Note, genu means knee, as it genuflect or bend the knee. There are usually 4 of these branches identified by their location, as in the superior medial genicular artery, inferior lateral genicular artery. The popliteal artery extends to just below the bend of the knee, where it bifurcates into the anterior tibial artery and the posterior tibial artery, which extend to the foot. The anterior tibial artery extends inferiorly along the anterior lateral surface of the tibia, or the shin, to the top of the foot, where it becomes the dorsalis pedis artery, or the great dorsal artery of the foot. The dorsalis pedis artery continues down onto the foot, where it gives its rise to a branch called arcuate artery. Arising from the arcuate artery are branches to the toes called digital arteries. Posterior tibial artery gives rise to a branch as it descends through the leg called the peroneal or fibular artery, which provides the blood supply to the muscles of the calf of the leg. The continuation of the posterior tibial artery enters the foot behind the malleolus, where it bifurcates into the medial and lateral plantar arteries of the foot. These then give rise to the additional digital arteries, providing the blood supply to the toes. The arch of the aorta has 3 branches, including the brachiocephalic trunk or innominate artery, providing the blood supply to the right upper extremity in the right side of the head and neck. 2. Left common carotid artery, providing the blood supply to the left side of the head and neck. 3. The left subclavian artery, providing the blood supply to the left upper extremity. A distinction should be noted in the manner in which the blood from the arch of the aorta proceeds to each of the upper extremities. The brachiocephalic trunk is a relatively short artery, about 1.5 to 2 inches, which terminates by bifurcating into the right subclavian artery and the right common carotid artery. The right subclavian artery is then very similar to the left subclavian artery in that each gives rise to the similar branches and have similar points of termination, though their origins differ. The right common carotid artery also resembles the left common carotid artery in that gives it rise to the similar branches and has a similar termination. Each of the subclavian arteries extends laterally towards the corresponding upper extremity, changing names to become the axillary artery as it passes the later border of the first rib. The subclavian arteries give rise to several major branches. The vertebral artery is a branch of the subclavian artery which courses the neck, passing through the transverse processes of most of the cervical vertebrae. It provides the blood supply to parts of the spinal cord and brainstem. The vertebral arteries end by passing through the floor of the cranium and then uniting to form the basilar artery, which feeds into the circle of Willis or cerebral arterial circle. The internal thoracic artery or internal mammary artery is another branch of the subclavian artery. It descends along the anterior thoracic wall, giving rise to the anterior intercostal arteries. Each runs just lateral to the sternum, providing the blood supply to the rib spaces. The anterior intercostal arteries will anastomose with the corresponding posterior intercostal artery, thereby providing a continuous blood supply to the rib spaces. The other two branches of the subclavian artery are the thyrocervical trunk and the costocervical trunk. The thyrocervical trunk gives the origin to branches which provide the blood supply to the underside of the thyroid gland, anterior root of the neck, and the area of the shoulder which just above the scapula. The costocervical trunk's branches provide the blood supply to the posterior intercostal spaces 1 and 2, as well as deep muscles of the neck. As the subclavian artery passes the lateral border of the first rib, it becomes the axillary artery. It should be noted that the axillary artery is very deep until it becomes superficial in the axillary space, the area under the arm or the armpit. The axillary artery gives rise to the branch providing the blood supply to the shoulder joint, muscles of the chest and wall and of the shoulder, as well as around the head of the humerus. The axillary artery extends into the arm to a joint just inferior to the lower border of the tendon of the teres major muscle, where it becomes the brachial artery. The brachial artery courses down through the arm to a joint just inferior to the bend of the elbow, where it bifurcates into its terminal branches, the radial artery and the ulnar artery. The most prominent branch of the brachial artery is the deep brachial, or the brachial profundus artery, which runs parallel to the brachial artery, providing the blood supply to the muscles of the arm. Other branches provide the blood supply to the muscles of the elbow joint. The forearm has two major arteries, the radial artery and the ulnar artery. Both are formed from the bifurcation of the brachial artery. The radial artery lies on the lateral side of the forearm, while the ulnar artery lies on the medial side, each parallel to the corresponding bone of the similar name. Each vessel continues into the palm of the hand, where it becomes one of the palmar or volar arches. The radial artery becomes the deep palmar or volar arch, which loops around and connects with the ulnar artery. The radial artery is relatively close to the anterior surface as the wrist, which is why it is often used to take one's pulse. It is also one of the easiest vessels to raise in order to incheck one hand during the embalming procedure, since it just lies lateral to the tendon of the flexor carpi radialis muscle. The ulnar artery becomes the superficial palmar or volar arch, which loops around and connects with the radial artery. Branches of the palmar arches providing the blood supply to the fingers are called digital arteries. Note that there are digital arteries in both hands and feet. Remember that the arch of the aorta has 3 branches, 2 which provide the blood supply to each side of the head and neck. They include the brachiocephalic trunk or innominate artery, which providing the blood supply to the right upper extremity and right side of the neck and head, and the left common carotid artery providing the blood supply to the left side of the head and neck. Common carotid arteries are very similar to the branches and points of termination, though each differs in its points of origin. The common carotid arteries extend up the neck to a joint just below the level of the jawline, where each bifurcates into the corresponding internal carotid artery and external carotid artery. The external carotid artery provides the blood supply to the structures of the neck and head, which in general lie outside of the cranium. The internal carotid artery provides the blood supply to the brain within the cranial cavity and the eyes. The external carotid artery has 8 branches serving the neck and outside of the skull. The superior thyroid artery provides the blood supply to the superior portion of the thyroid gland. The lingual artery is the blood supply to the tongue. The facial artery provides the blood supply to most of the face. It has own branches, the mental artery supplying the chin, the superior inferior labial artery supplying the lips, and the nasal artery supplying the area around the nose. The occipital artery provides the blood supply to the scalp and the back of the skull. The posterior auricular artery provides the blood supply to the area of the scalp directly behind the ear. The ascending pharyngeal artery provides the blood supply to the pharynx, the throat area directly behind the mouth. The maxillary artery provides the blood supply to the bones of the jaw and of the mouth. The superficial temporal artery, which is the terminal continuation of the external carotid artery, provides the blood supply to the region of the scalp just anterior to the ears. The internal carotid artery is the branch of the common carotid artery, which provides the blood supply to those areas of the head which are located primarily inside the cranial cavity to the eyes. There are 4 major branches of the internal carotid artery. The ophthalmic artery is the branch that provides the blood supply to the eye. The other 3 branches are all closely related to the blood supply of the brain. The anterior cerebral artery and the posterior communicating artery are the the branches which are part of the circle of Willis, or the cerebral arterial circle. The middle cerebral artery is the fourth branch, and along with the anterior cerebral is a terminal branch of the internal carotid artery, providing the blood supply up the side of the brain. The cerebral arterial circle, or the circle of Willis, is where the arteries providing the blood supply to the brain anastomose, providing multiple sources of blood supply to its vital organ. There are four major arteries which direct blood towards the brain. There are right and left internal carotid arteries and the right and left vertebral arteries. The two vertebral arteries unite after they enter the cranial cavity to become the basilar artery. The basilar artery then feeds into the circle of Willis by bifurcating into the right and left posterior cerebral arteries. The circle of Willis is generally considered to be made up of 9 arteries. They are the right and left internal carotid arteries, the anterior communicating artery, which serves to link to the right and left anterior cerebral arteries, the right and left posterior cerebral arteries, and the right and left posterior communicating arteries, which link the internal carotid artery to the corresponding posterior cerebral artery. Some may include the basilar artery as part of the circle of Willis, which is done there would be 10 arteries in the makeup of the cerebral arterial circle. The superior vena cava is formed by the union of the right and the left brachiocephalic or innominate veins. The brachiocephalic veins are formed by the union of the internal jugular vein and the corresponding subclavian vein. The inferior vena cava is formed by the union of the right and left common iliac veins. The coronary sinus results from the uniting of the small coronary veins coming from the heart muscle. The pulmonary veins results from the merging of the small veins coming from the capillary beds in the lungs. The azygos system is a group of veins which serve to drain blood from the walls and organs of the thoracic cavity. It is compromised by the Azygos vein, Hemizygos vein, accessory hemizygos vein in their tributaries. The azygos vein begins a continuation of the right ascending lumbar vein at about the level of the right kidney, and it courses up through the diaphragm, draining the intercostal veins on the right side. It terminates by emptying into the superior vena cava. The hemiazygos vein begins as a continuation of the left ascending lumbar vein at about the level of the left kidney, courses up through the diaphragm, and drains into the intercostal veins on the left side. It terminates by crossing over at about the level of the heart and emptying into the azygos vein. The accessory hemiazygos vein begins at a continuation of one of the first intercostal veins on the left side and descends along the vertebral column to about the level of the heart, where it empties into the hemiazygos vein. The tributaries of the inferior vena cava are in some respects not unlike the branches of the abdominal aorta. The tributaries can be divided into parietal or visceral tributaries. Parietal tributaries would be those veins that are draining the walls surrounding the cavity, while those that are visceral would serve to drain the organs. The parietal tributaries of the inferior vena cava include the lumbar veins, which drain the walls of the lower back, and the inferior phrenic veins, which drain the underside of the diaphragm. The visceral tributaries of the inferior vena cava include the hepatic veins, which drains the hepatic portal system, the right and left renal veins, which drain the kidneys and left side paired organs, right gonadal or ovarian or testicular vein, which drains the right ovary or testicle, and the right suprarenal or adrenal vein, which drains the right suprarenal and adrenal gland. Anatomically, the inferior vena cava lies on the right side of the abdominal aorta. Therefore, for the veins to empty into the left side, they must cross over the aorta. Because of this, the left suprarenal or adrenal vein empties not into the inferior vena cava, but instead into the left, which is a tributary to the inferior vena cava. Similarly, the left gonadal or ovarian or testicular vein empties into the left renal vein, which then empties into the inferior vena cava. The hepatic portal system is the system of veins which serve to drain the organs of the digestion in the abdomen. The blood from these organs must first pass through the liver. This accomplishes several functions. One function is to filter the blood by removing various substances. Some of these substances, such as glucose, are modified and stored by the liver, while harmful substances absorbed through the digestive tract are detoxified and eventually eliminated from the body by the kidneys. The hepatic portal system includes the inferior mesenteric vein and its tributaries, which drain the last half of the large intestine. The inferior mesenteric vein is itself a tributary to the splenic vein, which has tributaries from the pancreas, spleen, and stomach. The inferior mesenteric vein is also part of the portal system, and it has tributaries which some from the small intestine and first half of the large intestine. The splenic vein and the superior mesenteric vein then unite to form the portal vein, which bifurcates separates as it enters the liver. After being filtered in the liver, blood is then drained by the way of the several hepatic veins, which are tributaries to the inferior vena cava. The dural sinuses are veins in which drain the brain. They serve to drain the structures inside the cranial cavity. They derive their names from the dura mater and the outer membrane surrounding the brain and spinal cord. They eventually empty into the sigmoid sinus, which gives rise to the internal jugular vein. The internal jugular vein then unites with the corresponding subclavian vein, form the Brachiocephalic vein. Most of the veins draining the face and scalp have names similar to their corresponding arteries. Those veins to the face and scalp anterior to the ears empty into the internal jugular vein. The internal jugular vein, very important to many embalmers because it serves to drain both the brain and the face. Those veins which drain the scalp behind the ear are drained by the external jugular vein. The external jugular vein is in turn a tributary to the corresponding subclavian vein. Therefore, the subclavian unites with the internal jugular to form the Brachiocephalic vein. The deep set of veins in the upper extremity have exactly the same name as the accompanying arteries. Beginning in the forearm are the radial arteries and the ulnar arteries, which unite to form the brachial vein just below the bend of the elbow. The brachial vein courses up the extremity, and when it passes the tendon of the teres major muscle, it helps from the axillary vein. The axillary vein then becomes the subclavian as it passes the first rib. The subclavian vein unites with the internal jugular vein to become the brachiocephalic vein, which then unites with the opposite brachiocephalic or innominate vein to form the superior cava. The superficial veins of the upper extremity are the cephalic and the basilic veins. The cephalic veins begin on the lateral side of the hand and courses up the extremity to empty into the superior portion of the axillary vein. The basilic vein begins on the medial side of the hand and courses up the extremity, uniting with the brachial vein to become the axillary vein. There are various smaller veins which connect between the basilic and the cephalic veins, the most common one being the cubital vein, often used by the phlebotomist from which to draw blood. As in the upper extremity, the deep set of veins in the lower extremity have the same names as their arteries. Beginning at the lower portion of the leg, the anterior tibial vein unites with the posterior tibial vein to become the popliteal vein just below the bend of the knee. The posterior tibial vein has a tributary, the personal vein, which drains the muscles of the calf. The popliteal vein has its tributaries, the genicular veins, which help drain blood from the knee area, and becomes the femoral vein as it passes through an opening in the adductor magnus muscle. The femoral vein courses up the thigh and passes under the inguinal ligament to become the external iliac vein. The external iliac vein then unites with the internal iliac or hypogastric vein to become the common iliac vein. The right and left common iliac veins then unite to form the inferior vena cava. The superficial veins of the lower extremity are the two saphenous veins. The long or great saphenous vein begins on the medial side of the foot and courses up the extremity where it empties into the femoral vein in the region of the femoral triangle. This vein is perceptible in most people, particularly when it comes to the varicose following of the deterioration of its valves. The short or lesser saphenous veins begin on the lateral side of the foot and courses up the extremity where it empties into the popliteal vein. Oftentimes there will be interconnections with the greater saphenous vein.